So I want to thank everyone for being with us today. I especially want to thank Ben Milano and Vincent Garrity. And I also want to thank all of our recruiters, all of our speakers, all of our students in graduate schools, whether they were medical students, dental, nursing, public health, science students, for being a part of a great conference today. I know that many of you had different types of questions, and I'm hoping that you got all your questions answered. But if you have more questions, you can put them in the chat. We're here for another 10 minutes. But also want to let you know that our email is CHSP for College Health Scholars Program, CHSP at nhmamd.org. I think that what's important is that this program is funded by the U.S. Department of Services, Office of Minority Health, to be able to develop and share realistic, important information, secrets, if you will, that you don't learn from your parents, you learn from the students ahead of you, or from the admissions persons that we had as speakers today, or you learn from other doctors or nurses or dentists, public health professionals, on a career journey that is lifelong. And I want to tell you what that means. Lifelong journeys mean lifelong learning. And every step of the way, you have to learn from the people ahead of you. Some people call that mentoring. And mentoring might be one-on-one mentoring, where you have somebody that helps you and talks to you about what they learned and how you can learn from them. Well, you don't necessarily need a one-on-one mentoring. What you need is a place to go to ask questions from people that can answer it because they went through it themselves. And at NHMA, our National Hispanic Medical Association, our website, nhmamd.org, has a website for this NHMA College Health Scholars Program to do just that, to share information in 3 buckets: your personal development questions, your academic preparation questions and how to apply to a graduate school, your application questions, your interview, your statement of purpose, and also your financing, your education questions, because we know how important to understand where to get the funding and how to apply for the funding to keep going in school. So there's one model that I'm going to leave with you. It's called the Anticipatory Organization Model. It means that you have to anticipate your future. There's 4 steps. First step is to know what's next. If you're going to apply to nursing school, we were told you have to think about whether you want to go into academics. Do you want to be a nurse practitioner? Do you want to work in a hospital? You have to think about it. Where do you want to go? So the first step in applying to any graduate school, you're all college students, so applying to graduate school, you have to know what the graduate school requirements are. So you have to plan. So know what's next is all about planning. The second step is you have to develop the opportunities to be able to show that you are serious about your plan. And you have to be innovative. It's all about innovation. You can't look like the other person applying. You have to stand out. You have to apply to talk about being Latino or being Asian or being African American because you lived your experience and you know what your community needs. Not only that, we need you. So you need to do a really good job in telling your story, developing your opportunities. The third step is you shape your own future. If you want to be a researcher or if you want to be a dentist, then you really should start thinking about how you're going to show that you're interested. in those fields. You know, shadowing, doing some research, volunteering. You shape your future. You understand the culture of that career or the culture of that discipline. And then the last thing is you have to accelerate your success. So you have to find results. You have to get letters of recommendation. So you have to be really good at in a certain project to ask your supervisor in that project to write you a letter of recommendation. And you know what? This happens at every stage in medicine. In medicine, I mean all of the health career professions. You go from being a college student, which is pre-med or pre-dental, then you go into medical school or dental school, and then you got to do residency programs or fellowships. And then after that, you become faculty if you want to be a teacher, or a researcher if you want to do research, or like me, you go into government if you want to be a policy person. There are different stages of your career, but I have to tell you, and I don't want to be negative here. I want to be very positive. You have to find your passion because it's a lifelong career. So I wish you all well. Again, I'm Elena Rios, and President and CEO of the National Hispanic Medical Association. And I want to thank all of our partners, especially the Charles Drew University and the University of Incarnate Word, for being great partners this last few years. And we look forward to planning another virtual conference, maybe next January. It'd be great if we could do in-person conferences, but I'm not holding my breath. But let me just say that we welcome your comments, your questions, and please visit our website and tell others to visit our website for the information that we will all share. And if you have any other information to share with us, please let us know. And to all the recruiters, we want to thank you all for being here. And we look forward to continuing the referrals to you, not only for college students, but we are very interested in finding more Hispanic faculty for your schools. Whatever we can do to help, we're here to help. And Ben, I don't know if there's anything else. I think this is pretty much wrapping it up. Again, the National Hispanic Medical Association is happy to report that we work with the Hispanic Dental Association, the National Association of Hispanic Nurses, the Latino Caucus of the American Public Health Association, in this endeavor to find their students to be our, I'm going to say our resource students who are graduate students in all these fields. And we hope to expand to other health careers in the future. But right now, our proposal and our grant was limited to these fields. But we look forward to working with more professional schools. And I have to say that our board of directors is very interested in developing closer links, especially with the institutions that need help with diversity at all levels. Again, your leadership, your boards, your preceptors, look to us to find, especially the Latino resources for you all. Thank you very much.